Everyone. So today we're going to discuss antimicrobial drugs. Now we have a bunch of terms here that you should be familiar with, and you should know the difference between an antimicrobial and an antibiotic. So antibiotics in particular is a term for those drugs which are produced by either bacteria or fungi. And there are several categories shown here. Now this is not from your textbook, but this is a nice summary chart, which is why I'm including it. And these are the characteristics of the ideal antimicrobial drug. And in particular, I've highlighted 3 of them here. And the 3 that are most important are that it's toxic to the microbe, but non-toxic to host cells, that it's relatively soluble, and that it's readily delivered. And so all 3 of these, the takeaway of them is that we want something that's going to, of course, affect the microbe, but to not affect the patient, that is the human or the animal, whatever type of organism is being treated for the infection. And this first one is particularly important because there are lots of things that are toxic, Lysol for example, but you're not going to treat yourself for an infection with Lysol, especially if it's an internal infection. And the same thing with, hand sanitizer, for example. You might use that on your skin, or you probably will, but you cannot ingest that if you have a microbial infection, of course, because it's going to harm your cells as well as microbial cells. The reason why it doesn't hurt your skin cells is in part because we have a waxy covering on our skin. And then the other 2 that we pointed out here is all about getting that medicine to the site of infection, and also just distributing it. So we need things that we could sell in stores, that people or doctors can distribute relatively easily, and that we can use in our everyday life. So for example, most antimicrobials are in a powdered form. You might have a cream, or you might have a pill, but those are the more desirable forms of taking such a medication. And the last one, again, getting that specific drug to the site of the infection, getting it to those microbial cells, that's important. And this goes for many different types of drugs. We always want to treat the specific area of the body that's affected. So for example, think about when people are treated for cancer with radiation, that tends to harm cells all over the body, and that's why it's not used for other types of afflictions or for non-cancerous tumors, for example. Okay, so what are some examples of antibiotic targets? So antibiotic targets are specific parts of the microbial cells that are inhibited or that are prevented from working correctly, that are going to end up either completely stopping or inhibiting bacterial growth. And so the first one here, cell wall synthesis, that's easy to imagine why that would be useful. Of course, that's crucial for bacteria, and humans don't have cell walls, so it's not going to be an issue to take that as a drug for us. The second one, DNA replication and translation. So these have to do with processes that need to be carried out in the cell in order to make proteins. And while human cells do have DNA replication, transcription, translation, the molecules that do these are different enough in bacterial cells that they can be targeted and they won't affect our human versions of those molecules. And we'll get to this, come back to this in a couple of minutes. And then we also have a couple of other more specific things, so membrane structure and function and folic acid synthesis. I'm going to focus mostly on 1 through 3 for this lesson.